Next presentation, we now call upon Dr. Sayal to give his talk on visual outcomes following implantation of EDOF IOL in patients with macular degeneration.
Uh, this study was funded in part by research grant support from Alcon Laboratories. The purpose of this study was to evaluate visual outcomes following implantation of a non-diffractive extended vision IOL in patients with pre-existing early dry age-related macular degeneration. It was a prospective interventional case series performed at Raghudeep Eye Hospital at Ahmedabad and Jaipur, and all patients were 40 years of age and above, undergoing phacoemulsification for non-traumatic cataracts. All eyes underwent phacoemulsification with in-the-bag implantation of a non-diffractive wavefront shaping extended vision IOL, the VVT from Alcon Laboratories. Patients with uncomplicated age-related cataracts and nuclear sclerosis ranging from grade 1 to 4 on the LOCS 3 grading system and pre-existing stable early dry age-related macular degeneration were included, and early dry AMD was defined based on the AREDS2 study criteria, which means multiple small drusen's less than 63 microns or few intermediate drusen's between 63 to 125 microns, or pigmentary changes at the macula. So they were both quantified on fundus photography by the retinal surgeon as well as on posterior segment OCT of the macular scan. All patients who had either wet macular degeneration, large drusen's, or any other retinal or ocular comorbidities were excluded from the study. The primary outcome was monoocular corrected distance visual acuity at 4 meters on the ETDRS chart. The secondary outcome measures were monoocular unaided distance visual acuity at 4 meters on the ETDRS chart, monoocular uncorrected and distance corrected intermediate visual acuity at 66 centimeters, and monoocular corrected and uncorrected distance near visual acuity at 40 centimeters. The average age was 68.5 plus or minus 8 years. There were equal number of male and females and almost equal number of right eye and left eye. And the axial length, the biometric parameters were the normal axial length patients, that is 23.37 plus or minus 1.1 millimeters. So no extremes of axial myopes or hyperopes. And the average nuclear sclerosis was 2. 63% of eyes required a toric version of the VVT, as all of the patients were calculated on the Barrett's toric calculator and all needing toric IOLs were included. Coming to the results, the uncorrected distance visual acuity in logmas was 0.12 plus or minus 0.07, which is equivalent to 6969 parts, and the corrected distance visual acuity was 0.1 plus or minus 0.1. So the mean corrected distance visual acuity in Snell's equivalent was 6 by 7.5. The uncorrected near visual acuity was 0.25. Corrected intermediate visual acuity was 0.1. Similarly, the uncorrected near visual acuity at 40 centimeters was 0.23, and the corrected near visual acuity was 0.1. The average near add needed for 66 centimeters was 0.86 diopters plus or minus 0.18, and the average near add needed at 40 centimeters was 1.36 plus or minus 0.18 diopters. The most important part of the study, that is studying the contrast sensitivity with and without glare in physiological mesopic conditions, that is in a dark room at different cycle speeds 3, 6, 12 and 18. Fortunately, with glare and without glare, none of the cycle speeds showed any significant difference or worsening of the contrast sensitivity in the mesopic conditions. There is now early literature showing encouraging outcomes of these non-diffractive wavefront shaping IOLs in eyes with subtle macular pathology. The strength of our study, this being prospective and following the strict AREDS2 criteria, is one of the strengths of our study. So in conclusion, the non-diffractive extended range of vision IOL had very good distance visual acuity, along with good intermediate and near visual acuity, but most importantly without compromising the contrast sensitivity. The clinical implications can be that it can be considered in select eyes with stable early dry macular degeneration. The visual potential in such eyes may be suboptimal due to the disease itself, and therefore patient counseling preoperatively remains equally important. However, the good part is that the IOL does not seem to cause further deterioration of either the visual acuity or the contrast sensitivity. Thank you so much.
Excellent presentation. I just wanted to know what was the real aim you were trying to find out with this?
So the aim, the thing is that the extended, until now, presbyopia correcting IOLs are the multifocal and the trifocals, which are absolute no-no in any form of ocular comorbidities, including retinal pathologies. With the extended depth of IOLs coming up in the last 4-5 years, there is more and more increased interest whether they can be used in eyes with subtle macular pathologies as well. So the aim here was to see, first of all, whether this IOL is making things worse in a patient with a stable retinal pathology. So the aim was to find out whether it's doing any harm to the patient.
Because at the end of the presentation, there was one line which said the vision will still be compromised.
Yeah, because the age related, say for example, so if the visual potential is only 6/9, it will remain 6/9, or if it is 6, but it's not making the contrast or any of the other parameters worse compared to the already existing outcomes of these IOLs in normal eyes. So the average near ad required, the contrast sensitivities, everything is comparable. Yeah.
Thank you.
Thank you, sir.